Good evening. Thank you for coming to this press conference. The intervention we have put in place over the last few months have helped to keep the number of COVID-19 cases in the community low, at an average of about 1 case per day, and the number of unlinked cases fewer than that. And I want to thank everyone for your efforts. We can now resume more activities, but we will need to do that while keeping everyone safe. Learning from the experience of other countries, the key is not to rush into it, but to do so progressively and cautiously, while continuing to stay vigilant. We must be extra careful with activities that are known to have a higher risk of seeing super-spreading events to prevent the emergence of large clusters. We have taken a cautious approach to events like weddings. Some couples have put off their wedding plans in the hope that they can ride out the pandemic and proceed with their original plans for a large wedding reception, like what we used to do before the COVID-19 pandemic. But the end of the pandemic is still some way off, and indefinitely postponing a wedding may not be practical or desirable. Currently, marriage solemnizations with up to 50 persons have been allowed. We have also launched a pilot where, in addition to the solemnization ceremony, each wedding couple is also allowed to hold one wedding reception with up to 50 attendees at venues that are permitted to serve food and drinks, such as restaurants and hotels. From 3rd October, we will expand the pilot for wedding receptions to allow up to 100 unique attendees in total, including the couple and their families. To ensure safe distancing, participants have to be split into zones of up to 50 attendees each, or to be separated by staggered time slots with up to 50 persons in each slot. The cap for marriage solemnizations will also be increased to 100 persons, split across multiple zones of up to 50 persons each. Starting in November, we will also launch a pilot to allow wedding receptions organized by a registered wedding organizer to take place at the HDB common areas such as void decks and multipurpose halls. These premises do not have physical perimeter, and therefore enforcement of safe distancing measures may be quite challenging. So we will take a more cautious approach. If the pilot turns out well, we will expand the scheme later. The Ministry of Culture, Community and Youth will share more details later. Couples do not really need to wait until November. They can already hold their events at function rooms and multipurpose halls at our community clubs, which have been made available for wedding receptions at very affordable rates. Although wedding receptions are higher risk events, as large groups of people interact and mingle, we believe that with strict adherence to the safe distancing and safe management measures and discipline by all guests to do their part, we can mitigate the risks and still enable a joyful occasion for wedding couples and their families and friends as they come together to share this meaningful milestone in the couple's lives. We have also reviewed the precautionary measures for places of worship. Globally and in Singapore, we have seen large clusters seated at religious gatherings, and we have therefore been very cautious in mitigating transmissions at these events. At the same time, we recognize that religious activities and worship are important facets of many Singaporeans' daily lives. Since 7 August, the Ministry of Culture, Community and Youth has worked with 12 religious organizations to pilot religious services with up to 100 attendees, split in 2 zones of 50 each. The pilot has shown that safe distancing measures can be effectively implemented. So from 3rd October, all religious organizations will be allowed to conduct congregational and other worship services of up to 100 persons, subject to safe distancing and safe management measures. MCCY is also considering a pilot to increase worship limits up to 250 persons, with 5 zones of 50 persons each. Further details will be released soon by MCCY. We hope these measures will go some way to help support Singaporeans' spiritual needs, especially during these difficult times. As we lift more restrictions, it becomes even more important to keep community cases low by detecting and isolating cases as early as possible. As we gradually reopen our economy and resume social activities, we have been testing more extensively in the community beyond the rostered routine testing, or RRT, of workers from the construction, marine, and process sectors. For example, we commenced voluntary COVID-19 testing for taxi and private hire car drivers and launched a pilot for storeholders at hawker centres, markets, and coffee shops in the Marine Parade constituency, as well as selected groups of food delivery personnel. Over the past 2 weeks, more than 10,000 taxi and PHC drivers have been tested. In addition, about 750 storeholders and food delivery personnel were also tested in Marine Parade in the pilot run over the weekend. I want to thank all those who have participated in this voluntary testing exercise. All of them have tested negative for COVID-19 so far, and this is a good sign, as it indicates very low prevalence in our community. It is also an indication that our safe distancing and safe management measures, coupled with the use of face masks and heightened vigilance on everyone's part, are powerful and effective weapons in our fight against COVID-19. Next, we will be considering extending this testing to other hawker centres, markets, coffee shops, as well as other groups, such as university students in hostels. Overall, the situation in Singapore is stable, but let us continue to keep up our vigilance and not allow the virus a chance to spread. In these past months, we have succeeded in changing our social behavior and social norms. We understand what needs to be done, and I thank everyone for taking these measures seriously. I know it is tough and sometimes quite tiring, but we cannot let our guard down and let complacency get the better of us. Each precaution we take, however small it may seem, is the key to keeping our families, our friends, and fellow Singaporeans safe. Thank you. Now I'll ask my DMS, Professor Kenneth Mak, to give a quick update on our medical situation.
Thank you very much, Minister. As of today, the 23rd of September, as of 12 p.m., the Ministry of Health has preliminarily confirmed an additional 12 cases of COVID-19 infection in Singapore. Based on our investigation so far, there is 1 case in the community, and this individual is a work pass holder. There are 4 imported cases, all of whom have been placed on stay-home notices after their arrival in Singapore. We're still working through the details of the cases, and further updates will be shared later tonight via the MOH press releases. The low numbers that we see, and we have seen this over the last fortnight, give us greater confidence that we can extend the pilots that Minister has mentioned, allowing events and social activities to resume safely in our community. But it's important that we must not be complacent. The daily reported numbers may on occasion still rise on certain days in tandem with the intensity of testing that we are doing of migrant workers in quarantine facilities, in and out of the dormitories, and on routine regular testing. We remain vigilant to detect any new clusters that may arise, and we will do our utmost to quickly isolate cases, to quarantine close contacts, and to disrupt all potential chains of transmission, whether these are in the community, in the workplace, or in the dormitories. And it rests on all of us as individuals, as members of society, to do our bit, as Minister has mentioned, in enforcing the discipline for safe distancing, safe management measures, and wearing a mask. Thank you.
Good evening. I'd like to say a little bit more about our plans for workplaces as part of the broader plans for the resumption of activities. In particular, the plans we have for employees to be able to return to work at their workplaces. I mentioned a few weeks ago that there was a tripartite group comprising employers, the unions and workers, as well as the government representatives discussing this matter. Since then, the tripartite group have finalized their agreements and recommendations, and they have agreed on the following arrangements. First, working from home should remain the default or preferred mode of working. But second, if there are employers who would like their employees who are presently working from home to return to the workplace, they can do so, but subject to two conditions. The first condition is that the employees must continue to work from home for at least half their working time. Meaning to say the employees who are presently working from home, if the employer would like them to come back, yes, it's possible, but these employees must continue to work from home for at least half their working time. Second, at any point in time, there should be no more than half of such employees at the workplace. So for example, if there is an employer with 10 full-time employees who are currently working from home, he cannot ask all 10 to come back to the workplace. But what he can do is to split the 10 employees into two teams, and each team can return to the workplace every alternate week, while the other team continues to work from home. When more employees are returned to work, we also want employers to do their part to minimize crowding and congregation at common spaces, in particular at our public transport. So we also call on employers to implement flexible work arrangements for their employees who are returning to work. In particular, we would like employers to put in place arrangements for their employees to be able to work partly at home and partly at the workplace. So it doesn't have to be such a binary arrangement, right? Either or, but it can be a combination of both. And at the time when the employee has to come back to work, employers should allow them to travel outside of peak hours. For example, they can do so in blocks of 10 a.m. to 4 p.m. or 1 to 5 p.m. in the office, and then the rest of the time they can work from home. So these sorts of hybrid combinations should be adopted by employers. We would also allow for more events to resume within the workplace itself. Work-related events can resume within the workplace. Such events would include conferences, seminars, promotion ceremonies, induction ceremonies for new staff, corporate retreats or meetings. So anything that's work-related can resume subject to prevailing safe management measures at the workplace. But large-scale social gatherings should not be organized either within the workplace or outside. That's the existing guidelines, and they remain the same. So no large-scale social gatherings, for example, celebrations, parties, team bonding events, dinner and dance or gala dinners. These should not resume at this present time. So the only things that would resume are work-related events. So I've just touched on some of the broad arrangements for workplace, safe management measures at the workplace, and for more employees to be able to return to their workplace. There are a whole range of detailed guidelines which the Ministry of Manpower will put out separately, outlining all the various safe management measures. We would also like to emphasize the need for everyone to continue to stay vigilant and to do their part in complying with all the prevailing safe distancing and safe management measures. We would like everyone to be part of the Trace Together program, So if you have not done so, make sure you download the app on your phone, or at some point when the distribution of the tokens reach your area, then you make use of a token if you so prefer to do so. But whether it's through the app or the token, please get on board the Trace Together program, because the more people there are participating in Trace Together, then the greater our confidence is in opening up and resuming more activities. At the same time, everyone needs to take the safe management measures seriously, be it at workplaces or in the community, and continue to comply and uphold these measures. If all goes well, if we can continue to maintain this level of compliance and we can continue to control the infection well, then we will be able to continue with this path of resuming and opening up our economy and our society steadily. We are already working out the roadmap towards phase 3, and we have some plans on how this can be done over the subsequent weeks. And when we are ready, we will share these plans with Singaporeans. But we really need everyone to cooperate and to do their part so that together we can have a safe and progressive resumption of activities in Singapore. Thank you.
Thank you. I would like to invite questions from the media.
Thank you, Minister. Can we have Soon Kiat from Zao Bao, please?
Good evening, ministers and DMS. Being the biggest employer, will the government also begin to allow more civil servants to return to their workplace? Second question, it was reported that the Malaysian government hopes to reopen the Malaysia-Singapore border for daily commuters in January. Are we also working towards this possibility? The Malaysian side is also looking at doubling the capacity for RGL and PCA. Any response to that from our side? Thank you.
The government, the public sector, will adopt what are prevailing guidelines. So with these new guidelines, agencies will look at their own needs, and to the extent that some agencies may have a requirement for more officers to come back, they will do so, but they will follow strictly these existing, the new guidelines that we have highlighted. If there is no need for officers to come back, then we would adopt the same principle, which is that working from home should remain the default arrangement as it is today. So that's the approach that all public sector agencies will adopt. On the discussions with our neighbors in Malaysia, we are continuing our discussions on all fronts, whether it's for daily commute or the expansion of the periodic commuting arrangement, as well as the reciprocal green lane arrangements. These discussions are ongoing with our Malaysian counterparts, and when we have any new updates, we will share them with everyone.
Thank you, Minister. Can we have Cheryl Goh from CNA? And please keep your questions to one question. Thank you.
Good evening, Ministers and DMS. My question is actually specifically for DMS regarding the announcement from MOM today about the 7-day pilot testing at dorms. Could you explain to us how the new testing, the mid-turbinate nasal method of swabbing, how is it different from the current method, and why does it allow a 7-day period instead of the usual 14 days? Thank you.
Thanks a lot, Cheryl, for the question you've asked. In fact, there are several questions in one, and I'll try to answer them in sequence. First, talking about the method for testing, we've been traditionally using nasopharyngeal testing. That is, using a small, thin swab stick, passing it through the nostrils all the way backwards towards the back of the nose. And while this has seen very effective collection of samples for testing, giving us very good results, we are very mindful that this is not a pleasant experience. And for individuals who have to do this on a very regular basis, currently the construction workers, those in the CMP sectors have to do this every 14 days. This can be, over time, a very traumatic experience. Sometimes, if this is done forcefully, you can even have nosebleeds, and therefore the workers might develop some aversion to wanting them to comply and continue with this process of regular testing. So we've been exploring different other ways of sample collection for our tests, and what we're doing now, and we are rolling this out progressively in phases, starting with our regional testing centers, and we hope to extend this in all other test settings, including in the hospitals, in the polyclinics, is to use an alternative means that can give us also a good sample, but hopefully without such a high likelihood perhaps of discomfort and potentially other complications. So this involves using a swab stick again, but instead of passing it all the way towards the back of the throat through the nose, it's just midway. And to where we in medical terms, we describe this as where the middle turbinates are, and getting a sample there, supplementing it with a second sample that comes from the back of the throat. Over time, we will be also studying whether or not we actually need these two sites for sample collection, and whether or not we might be able to dispense with one and just stay with one particular site of collection. But we need to validate those processes, and we're in the process of doing so. We are also committed to explore other possible methods, and that includes obtaining deep throat saliva specimens to see whether these might be effective alternative ways for sample collection for testing. But our studies are still in progress, and we are not currently in a position to shift towards using saliva testing at this point in time. So that's one part in terms of our way of trying to make testing a much more pleasant experience for those who are subject to testing regimens. Together with MOM, we've also been discussing whether we can be more proactive about picking up infections as early as possible. And this is in particular in high-risk settings where workers might be staying in dorms with communal living. They are going out to work. It is difficult to completely prevent mingling that takes place. So the environment is rich for a high risk for spread to take place very rapidly if any one individual within that community gets sick. And rather than just simply depend on the high precision and accuracy of our tests, we think it's also important for us to explore other ways of varying our testing, our surveillance. And one option that we are studying very at this point in time is to increase the test frequency. We test more often to see whether or not this can give us an opportunity to detect infections earlier and allow us then to intervene more decisively to break up chains of infection, prevent them from forming large clusters, and therefore allow for an opportunity for workers to continue to work in a safer environment, and also to prevent the disruptions that will take place when large numbers of workers have to be quarantined as a result of picking up positive cases during these testing regimes. So we will be starting off with doing the study in one of our dormitories, and we will start off with a 7-day testing cycle. And we may, at the end of the study, decide whether this is a regimen that can be safely extended to other dormitories. It may also allow us to think about more tiered approaches where higher risk dormitories might engage in higher frequency testing, whereas other dormitories might engage in the traditional 14-day cycle. So we are open to these possibilities, but we need to test and study this more closely. And we'll start off first with the study that we are doing in this particular dorm.
Thank you, DMS. Can we have the next question from Timothy Goh from ST? Please be reminded to keep your questions to one question. Thank you.
Hi, thank you, Ministers, DMS. I would like to ask what phase 3 will look like and when the restrictions on 5 people gathering will be lifted, given that we seem to be opening up everything else. Thank you.
I'm not sure if we are opening up everything else. We are still doing things in a calibrated and controlled manner. as I highlighted, we are charting out the roadmap to phase 3. It would include further relaxation and opening up of activities. For example, in terms of border measures, we can expect further opening up for travel with countries that are safe. Within the community, then we will look at a range of other measures, including the rules around dining, the number of people. The rule is 5 today. We might be able to allow for a higher number, as well as the rule around visitations. Again, that same number 5 applies, and we might be able to allow for a larger number too. We also would we would also look at the rules around various events that are happening. We announced today some relaxation for places of worship, for weddings. So as we embark on this roadmap towards phase 3, some of these measures can also be relaxed to allow multiple zones of 50 greater than what we have today, which is typically around 50 times 2 or 100 people. We could allow for more. So these progressive steps of opening are part of that roadmap towards phase 3. And as I said earlier, we will work through the potential pathway to phase 3, and we will share that with everyone when we are ready, perhaps in a few weeks' time. What's critical and what's very important for all of us to understand is that this progressive trajectory towards continued opening is contingent on all of us doing our part. It's not to be taken for granted, and it's not an automatic progression. It's contingent on all of us cooperating, as I said, being part of the Trace Together program, complying with safe management measures to ensure that contact tracing is effective. So together with that, as well as our continued increase in testing capabilities, I think all of that will give us confidence to continue with this trajectory towards steady, controlled, and safe reopening.
I should perhaps add to say that even as we move towards phase 3, you will also realize that from time to time, we may need to tighten some of the measures in our safe distancing and safe management measures. For example, the increased frequency of RRT for selected dormitories, which has higher risks, is one area that we are tightening to make sure that we minimize the risk of big clusters forming. And we may need to do this tweaking as we go along from time to time based on our risk assessment on the various activities and various sectors. So it is not opening all the way, as you put it. It's basically a calibration. We need to open somewhat to allow the economy and the social activities to resume. But at the same time, we need to tighten somewhat to ensure that our safe distancing measures are in place. A couple of weeks ago, we also tightened in terms of the enforcement of safe distancing in the F&B sectors, in the community areas, to make sure that people observe these rules and take these rules seriously. And by doing so, then it will allow us more capacity, more buffer to open up a little bit more, to relax, to ease off the measures a little bit more, and to allow more of the activities to resume. I think it's a balancing between easing the measures as well as tightening where it is necessary.
Sorry, Minister Wong, to clarify, when you said the lifting of the restrictions on 5 people, would that be in phase 3 or on the road to phase 3? Thank you.
If you remember, so many of you have been with us on this journey for months. If you remember, quite a while back when we laid out the 3-phase sort of sequence, we said that getting to phase 3 would in a way be the end of a process, and phase 3 would be a scenario that we are in all the way till a vaccine is available, right? So relaxing of some of these measures that I highlighted, including the rule of 5 for dining and home visits, will be part of the process from now to the subsequent phase 3, right? When we arrive at phase 3. So it's still in phase 2. It's still part of that continued trajectory of opening up, relaxation of measures. And then eventually we get to a point where we say this is where we think we are comfortable, and we will be there in phase 3 all the way through phase 3, and phase 3 will have to be sustained for some time until a vaccine is available. Of course, it doesn't mean that phase 3 is static. Even within phase 3, we might be able to consider further liberalization or opening, and a lot of this depends on, for example, the extent of testing that we can get access to. The current methods of testing rely heavily on the gold standard, on the PCR, but there are new methods of testing which are coming to the market, including very fast point-of-care tests, antigen tests. They are not as sensitive as the PCR gold standard, but they could be applied in various use cases that may allow us to open up more activities. So if this were to materialize, if these tests were to be made available, we could consider, even during phase 3, some additional liberalization and further resumption of activities. So that's to give a broad sense of where we are. Like I said, these are work in progress, and when we are ready, hopefully within the next few weeks, we will be able to share this roadmap towards phase 3 with everyone.
Thank you, ministers. Can we have Aradhana from Reuters, please? Please be reminded to keep your questions to one question. Thank you.
Yeah, this is on the business travel pass. I just wondered if you can say how many will be issued, when will this start, which will be the first countries that this will go to, and also what kinds of agreements do we need from the countries on the other side so the travelers don't have to go through, say, a quarantine or more tests on the other side.
So the details of the travel pass will be shared separately by MTI, but the basic understanding is this, that we would allow someone with this travel pass to be able to travel to quite a wide range of countries. Right? It's not going to be country specific. We will allow them with the travel pass to be able to travel. But of course, these travelers will have to comply with whatever travel restrictions or measures that are in place in that country that they are visiting. Either the national measures, or if we have reciprocal green lane bilateral measures, then these would apply. Right? So the travel pass cannot supersede these restrictions that are in place in that visit in the countries that they are visiting. They have to comply. But the travel pass allows the traveler to be able to travel to these different countries, and then when they come back to Singapore, they will not need to serve an SHN, and they have the option to be administered a COVID-19 test, and then they can continue on with the rest of their work. Right? So that's the whole idea of a travel pass. The idea is to be able to allow senior executives who are based in Singapore with extensive regional or international responsibilities to have a bit more flexibility to travel for their work reasons. So we are starting with a small number, and then we will distribute them out through our economic agencies.
Thank you. Can we have Nivetha from NHK Singapore next, please?
Hi, ministers. I'd like to ask about the age limit for the mask. I'd just like to confirm that, so for children below 6 years old, they don't need to wear the mask or the face shield. I mean, they are encouraged to wear the face shield, but they don't need to wear the mask or face shield. Yeah.
Thank you very much for the question, and this will be something that we'll also be covering in the press release that will come out today. We have had a series of guidelines for mask wearing, and for children, previously we had worked out that children below the age of 6 would have the option of of not necessarily wearing a mask. But we have since adjusted these guidelines in alignment with what the WHO as well as UNICEF have issued as their own guidelines. And we brought our national guidelines in alignment with that. So basically, our current guidelines, which allow for greater flexibility on mask use for young children and permit children currently 12 years and below to use a face shield in place of a mask. This part is consistent with what WHO and UNICEF recommends, but we haven't really fully reflected that in our current laws, and we are making some adjustments in the legal cutoff age for children to wear masks to up to 6 years and above from the current 2-year threshold. To protect young children from COVID-19, we continue to strongly encourage that children should wear, for young children to wear a mask or a face shield, especially if they are in a group setting, for example, in preschool or when they are in social activities interacting with other kids. Children and other persons who may not have the coordination necessary for the proper use of masks or face shields should continue to be supervised when they are using the mask, just to make sure that they are wearing the mask or face shield appropriately. So the guidelines we have will be harmonized with what WHO and UNICEF have issued. And this would be put into effect through our interactions and collaborations with our partner agencies in MOE, in EGDA, and so on. Thank you.
Thank you, panelists. Can we have the next question from Arshad from Tamil Merasu?
Good evening, ministers and DMS. I'm Irshad from Tamil Merasu. I would like to ask about the situation among foreign workers in the dormitories. Is it possible to see 0 cases soon among the foreign workers? Thank you.
We are trying our best to screen them on a regular basis, right? Remember, we started by doing a complete clearance of all the dormitories and the workers. We've completed that process. But as we highlighted and shared before, despite doing it as comprehensively as we can, no test can be foolproof, right? Even the best test is not 100% sensitive. So there will be a very, very low level of ongoing transmission, and the way to address that and to tackle that is to ensure, number one, continued practice of safe management practices at the dormitories and the work sites. That remains very important. But number two, through a very extensive regime of regular and routine testing of the workers. So we have gotten all the employers to get on board this regular testing program. Their workers are coming through this routine testing. I think we might need a few rounds of that before we can see continued decline in the cases. We went through something similar, if you recall, when we had the workers who were decanted out from the dormitories, and they were the essential workers, and they were decanted out and they were put in temporary living arrangements. And in order to ensure everyone's safety, we tested them one time, but then we put them through a second test, a third test, and even in the second and third cycles, for that group of workers, even in the second and third cycles, we continued to pick up positive cases. Right? So not surprisingly, for this, the group of workers who are in the dormitories, who are, despite that going through a comprehensive clearance process, we are now only going through the regular testing. We started in August, and we have not completed 2 or 3 cycles yet. But as we do so, as we complete a few more cycles of testing of these workers, I'm sure the numbers will come down steadily. So we are working on all fronts, and we hope to see the numbers continue to decline.
I should add that while we all hope to see 0 cases in the dormitory and in the community, but I must remind all of us that it doesn't mean that there are no COVID-19 cases in Singapore, because there will still be asymptomatic cases, undetected cases. Even with RRT, if you remember, it's currently on a 14-day cycle, and in between the 14 days, workers can get infected, and undetected until their RRT is due. And therefore, we are also increasing the frequency of the RRT for the high-risk groups to make sure that we are able to detect them as fast as possible. And if we do that rigorously, we will be able to continue to keep the numbers low, but it may not reach zero. Even in the community today, as you can see, from time to time, we do get 0 cases in the community, but it comes back because there's no possibility of a 0 case in the whole of Singapore until we have the vaccine available. So therefore, I think we need to continue to be vigilant. Even if we see one day 0 cases in the dormitory and 0 cases in the community, we cannot afford to celebrate because the day after that, it may not be 0 because there are still cases in the community being transmitted and we have to remain vigilant.